Okay, here we have assessment number 3. If you picked assessment number 3, pat yourself on the back. You are correct. What we want to do is we said with all the other 2 assessments, you had the head of the bed elevated. This is correct. We want the head of the bed elevated at 45 to 60 degrees. We want to make sure that there's no tension on the sutures, so we want to make sure that we're not putting the patient in a hyperflexion or hyperextension state. With the head of the bed elevated, we're going to help with edema that may be occurring. We want to check the back of the neck. Why do we check the back of the neck? We're checking for bleeding. Number 1 priority after airway with any patient who comes back from a thyroidectomy is the fact that they can hemorrhage. It's very rare, but it can happen. Remember, the thyroid is a very vascular gland. The next thing we want to check if there's any numbness or tingling around the mouth, the lips, or the fingers. Numbness and tingling means hypocalcemia. We're all aware that hypocalcemia can be a medical emergency if the calcium level is too low. We would check for other signs of tetany that would be occurring too, such as stridor. With the stridor, you would also want to check to make sure that the patient doesn't have stridor due to the airway closing off and the swelling around the surgical site. So assessment number 3 is the correct assessment. That would prioritize what you would do with your patient.